The final part of health that we're going to talk about is the emotional component. The emotional component, I think, is maybe the most important part of health. Emotions directly affect your physiology, and in chiropractic, if someone's under a lot of emotional stress and nothing is done to change how that affects the body, they're not going to hold their adjustments very well. They're not going to be very easy to adjust in the first place. So the main technique that we use in this office to help with emotional stress is called the Neuro Emotional Technique, which was developed about 20 years ago by a chiropractor, Dr. Scott Walker, who found that patients who were under a lot of stress tended to respond a lot slower than other patients. They didn't hold their adjustments very well. So he developed this technique in order to help his patients out. And a big part of why I use a lot of this technique in my office is because this is a technique that actually helped me a lot. I've been healthy most of my life, but like everybody, I've had emotionally triggered symptoms. And one of the weird symptoms that I used to have was I used to get a terrible headache if I was ever in a big group of people. I thought it was just social anxiety. Even in the very beginning of practice, if I had a busy day, at that time busy meant seeing more than 5 people in a day. If I saw more than 5 people in a day, I would get a terrible migraine and have to run to the back of the office and throw up. And fortunately for me, one of my colleagues came by one day and said, I bet that's emotional. And I said, yeah, no kidding. So what am I supposed to do about that? And then he did this technique, which is actually a physical kind of adjustment. And by stimulating different points on my spine, some points around my liver area, and holding my hand on my forehead, he was able to, in just like one adjustment, essentially, change this pattern to where I could be busy or I could be in a group of people and then not have this anxiety problem. So that definitely changed my life. And we see this also in the practice. We have a lot of cases where people have longstanding phobia issues where they have a physical reaction to whether it's getting on a plane or sometimes a phobia of animals. We had a patient who had a very longstanding phobia about cats. Every time there was a cat around, she would tense up and get very nervous and even have to call her husband to get the cat out of the vicinity. It was so stressful for her. So this technique helped to stop that reaction. And everybody has these reactions. I'm sure all of you have experienced it where you feel fine and then all of a sudden you get some very stressful news, stressful piece of mail, and you can feel it in your body. Your stomach will tense up, your muscles will tighten up, you may have a headache. And the opposite can happen too. You feel horrible and then you get some amazing news. Suddenly you're fine. Everything feels good. The sky is blue. So emotions play a very direct role in health, and in this office, not only do we work on people using techniques such as the emotional technique, but we also help them learn to manage the stress in their life more effectively, whether it's through deep breathing, yoga practices, working on the food, exercising. There's a study from the Mayo Clinic that shows that regular exercise, even brisk walking, just 30 minutes a day, 3 days a week, is in clinical trials, it's just as effective as Prozac for depression. So there's many factors that affect the emotional well-being, and that's one of the things that you learn also in this office. So in closing, I just want to let you know that consultations are always free in this office. So if you have any questions, you're always free to call, email. If you're not located in the San Francisco area, we know a lot of great doctors around the country and even around the world. So never hesitate to call or email if you are interested in a consultation or interested to see if we know somebody closer to where you are or where your loved ones are. I believe very strongly that a big part of the healthcare crisis is not just that people don't have insurance or that there's not enough money, but the big problem is that the basic paradigm is wrong. Drugs and surgery won't cause health. So if you get more drugs and more surgery for more people, it's not going to make us healthier as a country. So I'm hoping that more and more people will understand where health comes from, and we'll be healthier as a country and a community.